Ever wonder what everyone's doing on their phones? They're banking with Bank of America.
They're saving, planning, and budgeting all before dessert.
Digital tools so impressive, you just can't stop banking. What would you like the power to do?
Hi, everyone. I'm representing the founder community. I've heard some of the speakers that went just before me talking about how important it is to have founders at the table as we're thinking about the future of innovation and startups in Detroit. And so it's fun to see that coming together. My background is that I'm a social entrepreneur. I'm an exited founder. I started a company in 2015. And I'm going to talk a little bit about my experience as a boomerang kid. So someone who was born in Detroit, St. John's Hospital, went to college in Ann Arbor, ended up in San Francisco, and then came back and brought my startup back here to fundraise, which is kind of a strange reverse commute in a lot of ways, but what we're hoping to see. So hopefully my experience will shed some light on some of the advantages, some of the challenges, and what I see as opportunities going forward for entrepreneurs innovating specifically in healthcare, which was my sector. So my company was founded on a social breakdown, which is that we have addiction systems of care in the United States of America that are very outdated, that are often not very science-driven, and that have led to a lot of death in my own personal life, friends, family members. I'm someone who got sober very young after a wonderful rave teenage experience in Detroit, but saw people around me mismatched with care settings and the care that was available to them not at the top standards that are available in other parts of the country. So my company was born out of the idea that you could bundle best practices in clinical care and democratically deliver them through an app. So traditionally, people go to 12-step groups as part of their recovery, and that's worked from the 1920s on, particularly for alcohol. As we got further and further into the opioid crisis, a lot of individuals have mismatched with those care settings, in part because they're public, there's stigma, there's a lot of nervousness. You might be someone's teacher, a police officer, a leader in your community, and be really concerned about exposure. So what we did instead was provide a telemedicine application that allowed people to get private and discreet rehab from their phone. There are huge advantages to this. You can get support really anytime you need it. So if you're having a trigger at 11 p.m., you sneak into your bathroom and get some support from a coach. If you need medication right away, you can get access to a clinical care team that can deliver telemedicine medications to you directly to your pharmacy. And so this is something that we built that scaled dramatically. Particularly during COVID, we grew 400% year over year for 4 years in a row. So by the numbers, we raised $140 million in venture capital between our Series Seed and our Series C. I'm very proud to say that's, I think, the record for women in Michigan, which is like a very small portion of venture capital to begin with. So 3% of venture capital is raised by women, and we were a double women founder team. And so one of the things that I think drew a lot of people to our mission was the fact that we were working in healthcare and we were a B Corp. We were actually a social enterprise, so we had a triple bottom line. So a social mission that drove us to get clinical outcomes that proved that our intervention was working, and also the mission of growing rapidly in a venture-backed model that got us to 23 states during COVID. But unfortunately, we had to scale back after COVID due to regulatory restraints that came in after the pandemic, where it was no longer possible to deliver telemedicine care from Michigan to other states around the country. So that's something I like to advocate for, because there's a ton of telemedicine innovation that goes on that could be supported by Michigan residents working with policymakers to ensure that we are able to receive care and give care to other states around the country. So in terms of our Series C, by the time we got to that size, we were about 423 employees, but we were based, 60% of us were in Michigan. And there were huge advantages to that. The cost of Individual salaries in Michigan is much more affordable for social workers. When I lived in San Francisco, social workers it was impossible to live on a $60,000, $70,000 a year salary. We have huge advantages in Michigan by having a huge wide array of clinical training programs from all the universities that were represented today, and to have those individuals the best in their fields available to enter the medical digital health workforce. So these are some of the strengths that I see that we have in this coming period of AI innovation in my sector specifically. So when I started the company, we were using AI very little. By the time we got to our Series C, we were working to develop machine learning models that allowed us to deliver better care concierge programs, to elevate people that were the most in need and get them triaged the fastest to our care teams. And that's just one application of thousands that are becoming available as we speed up the rate of digital health innovation. I think we're about 5 years away from a time period where we will have AI clinicians, probably mostly augmenting existing physical MDs, but it's amazing what it can already do today. So what we're seeing that's driving these huge paradigm shifts is huge expansion of computational power to do things that are interesting, and particularly in healthcare, the most relevant use cases where we have the most proof that we can do something feasible. That's not a 20-year goal of being, autonomous robots floating in the air, but we have the speeding up of genetic data, microbiology data to an extreme level of accuracy that's going to cause drug discovery to speed up dramatically, as well as other innovations, particularly in areas like I'm interested in, such as the microbiome. So all of these come together to put us in a pretty exciting position as a state not only that's leading in computer science programs, but a state that has biotech and medtech proven founders, exited founders that are already here in the state that can mentor others. We have the skilled workforce. We have the cost of living advantages. We already have a number of exited founders from other states coming to Michigan because of climate change, because they're seeing risks in raising in their families in places like LA or in New York. And so I think we're in just a killer position. And I'm really excited to see where we go from here in terms of both the innovation that's possible from startups, but also the increasing returns from all of the innovation across our different cities. I like to think of this area as an area and not Detroit, Ann Arbor, Grand Rapids. Silicon Valley calls itself Silicon Valley, and it encompasses many cities across a huge area. So I'd love to see us rebrand ourselves in that way as just a broader, bigger vision that's not quite so regionally specific. That's all, and thanks for listening to my story, and I'm excited to see digital health innovation ahead.
Ever wonder what everyone's doing on their phones? They're banking with Bank of America.
They're saving, planning, and budgeting all before dessert.
Digital tools so impressive, you just can't stop banking. What would you like the power to do?